Yeah, sure. This morning we discussed about how to best optimize the use of something which is necessary in myeloma, because myeloma is a disease of the bones. So of course, nearly all the patients during the course of the disease will develop some bone lesions. So it's important to use at best these tools. So we spoke about both staging and evaluation of response, and also early phases of the disease. So we have basically three imaging techniques: CT scan, MRI, and PET-CT. So we put the attention on the fact that the three techniques are looking at different things. So we are not exactly looking at the same thing, because PET is looking at the metabolism of the disease. MRI is looking at cellular infiltration of the bone marrow, so the soft part of the bone. And CT is looking at osteolytic lesions, that is to say, the destruction of the bones that already happened. So for sure, CT scan is the minimum requirement. So that's recommended each time you have to stage the disease. And nearly all the centers now do have a whole body low-dose CT scan available. So you can use this just to map the lytic lesion. MRI is the most sensitive technique because it's seeing just a very small infiltration of the bone marrow. So it is the recommended techniques in early phases of the disease. So if you have to look deep inside the high-risk MGUS, smoldering multiple myeloma, pick an MRI and not a CT scan that will be negative 99% of the time. PET-CT is a dual technique, so it has the CT part and the metabolic part. So it's the recommended technique currently to evaluate the response after therapy, so to have a minimal residual disease evaluation, and for extramedullary disease. So different settings. At the end of the day, you can combine, you can use just one. What is recommended is to use the one which is available in your center and in which there is the highest expertise, because it's also important how you are reading these techniques.